Hello, welcome to Learn English Lab. Today's podcast, English Listening Practice Podcast, topic name is 35 plus C1 level vocabulary. Right here on the deep dive, we're taking a truly unique collection of specialized terms, all related to health, and we're not just skimming the surface, we're diving deep. Our mission isn't just about memorizing what these words mean, it's about really grasping their subtle power, their specific context, and when and why they truly matter. Think of this as your express lane to being genuinely well-informed and confident when these crucial terms pop up. In conversation, in your reading, or, in your professional life, we want to equip you with those surprising facts and just enough interest to keep you hooked.
That's absolutely right. When you're aiming for C1 level proficiency, especially in an area as complex as health, it's just not enough to know the dictionary definition. It's about moving beyond basic communication, allowing you to engage in truly nuanced and well-sophisticated discussions. Within medical, wellness, and even psychological domains, this deep dive aims to give you that shortcut, providing the rich context and analytical depth needed to truly understand and confidently wield these words in any setting.
And for you, our listener, the goal is delightfully straightforward.
Right.
To gain knowledge swiftly yet thoroughly. We're aiming for those aha moments,
Yeah.
Where complex concepts suddenly become crystal clear, making you feel completely on top of the subject matter. It's about moving from simply knowing a word to understanding its entire ecosystem.
Exactly. And to help us navigate this extensive and fascinating vocabulary, we've structured our deep dive in a logical way. We'll be exploring these terms based on their grammatical function. We'll start our journey with a collection of essential nouns, then we'll transition into dynamic verbs that describe actions and processes, and finally, we'll round things out with insightful adjectives that color our understanding. This categorization should help you not only grasp the meaning of each word, but also its full scope and how it functions.
All right, let's truly unpack this. Our guiding principle for this deep dive into C1 health vocabulary is all about embracing nuance and demanding precision in language. Especially in a field as incredibly sensitive and significant as health, knowing exactly the right word isn't just a matter of grammatical correctness. It's about enabling discussions that are exact, that carry specific weight, and that facilitate crystal clear communication. Whether you're conversing with a healthcare professional, deciphering complex research papers, or just discussing wellness, that level of linguistic precision is genuinely empowering.
Precisely. Each term we've meticulously selected for this deep dive isn't just a random vocabulary entry. They are all drawn from advanced lexical resources, which truly signifies their critical role in sophisticated discourse. It's about building a robust vocabulary foundation that supports a far deeper comprehension of complex health concepts. Moving beyond surface-level understanding to something much closer to, genuine expertise, we're aiming for that intellectual satisfaction that comes from truly understanding.
Okay, kicking off our exploration today, we're diving into a collection of powerful nouns. And the very first word we're unpacking is antiseptic.
Right. An antiseptic is essentially a substance used to prevent infection. Its primary action is killing or inhibiting the growth of bacteria when applied to wounds or living tissue. You can think of it as a protective shield against microscopic invaders. While related, synonyms like disinfectant, germicide, and bactericide exist, with disinfectant typically referring to use on inanimate objects, which is, a key distinction in medical settings.
Okay, to kick us off with an example, you might hear this. The doctor recommended using an antiseptic mouthwash to maintain oral hygiene.
Yeah, this really highlights its role in everyday preventive care. An antiseptic mouthwash actively works to reduce the proliferation of harmful bacteria in the mouth. This, in turn, helps avert common oral infections like gingivitis, which is a type of gum inflammation. It's all about being proactive, really, maintaining a healthy oral environment and preventing problems before they even have a chance to start.
Right, proactive care. Beyond daily routines, another way you'll encounter this word is nurses applied an antiseptic solution to the surgical site before the operation began.
Oh, definitely. This exemplifies its critical clinical application. The term truly underscores the stringent hygiene protocols that are absolutely essential in medical procedures. Sterilizing the surgical area with an antiseptic solution is paramount for preventing serious post-operative infections. This showcases the incredibly high stakes involved, in maintaining medical cleanliness in such delicate situations.
High stakes indeed. And interestingly, it also appears in non-medical contexts. Travelers often carry antiseptic wipes to clean minor cuts while on the go.
That's a great point. This broadens the scope to everyday, non-medical settings, yet shows its practical utility. Antiseptic wipes offer immediate wound care in situations where full sterilization isn't possible, maybe during outdoor activities or while traveling. They help inhibit bacterial growth, providing an immediate sense of protection and reducing the risk of infection when proper cleaning facilities simply aren't available.
So if I'm understanding this, antiseptics aren't just for dramatic movie scenes. They represent our first line of defense, from everyday oral care to life-saving surgeries. It really illustrates how constant vigilance against unseen threats is paramount in maintaining health. That's a great initial nugget of knowledge for us.
Indeed. It's about recognizing that layers of protection, visible and invisible, are fundamental to modern health practices.
Shifting gears a bit, let's now explore a term that carries significant weight and often sparks wider conversations beyond the purely medical: abortion.
Right. Abortion refers to the intentional ending of a pregnancy, typically performed in its early stages. Synonyms like termination, induced miscarriage, or fetal expulsion are often used, and it's particularly important to recognize the sensitive nature of this topic and how differing terminology can reflect very varied perspectives and, well, deeply held beliefs.
To illustrate this, let's consider. The medical team discussed the risks and benefits of abortion procedures with the patient before she made her decision.
This portrays its usage squarely in clinical consultations. It highlights the paramount importance of informed decision-making in reproductive health. It sheds light on the ethical considerations that medical professionals and patients navigate, ensuring individuals are fully aware of all aspects, medical and personal, before making such a profoundly significant choice.
Taking a step back, this also applies to a wider lens. Legal debates surrounding abortion rights continue to evolve in many countries.
Yeah, here, the term is explored within a broad socio-political framework. It points to the ongoing global discussions about access, legality, and women's bodily autonomy. What's fascinating here is how the very language used, rights, choices, life, personhood, shapes the debate itself. As impartial observers, we note that these are complex societal conversations, constantly evolving in their scope and impact across different regions and legal systems. It often demonstrates how language can be a battleground for ideas.
Absolutely. And finally, a crucial look at the personal impact. Counseling services provide support for individuals dealing with the emotional aftermath of an abortion.
Yes. This addresses the profound psychological aspect. The term relates to the critical post-procedure mental health care and the often long journey of emotional recovery that individuals may experience. It acknowledges the complex emotional landscape that can follow such a procedure, highlighting the deeply personal nature of health and the universal need for compassionate support systems.
It's truly a topic where language matters immensely, perhaps more than anywhere else in health. The way a word is framed, or even the synonyms chosen, can completely shift the entire conversation. It highlights how much our vocabulary is intertwined with societal values and ethical frameworks.
Absolutely. The sensitivity around this term emphasizes the need for precise and empathetic language, recognizing the deeply personal and often public dimensions of health decisions.
All right, let's talk about a word central to patient comfort during medical procedures: anesthetic.
Okay, anesthetic. It's a drug specifically designed to make part or all of the body unable to feel pain when it's administered. When we talk about synonyms, we have analgesic, which primarily reduces pain, a numbing agent, quite descriptive, and sedative, which typically induces calmness or sleep. Each of these has slightly different primary effects and applications, depending on the specific medical situation.
Right. To give us a common scenario, some patients experience temporary numbness or tingling at the injection site after receiving anesthetic.
Yeah, that illustrates a very common and thankfully temporary bodily response. It highlights the anesthetic's direct role in managing pain during minor procedures, like routine dental work, where a localized numbing effect is desired without affecting the patient's full consciousness. That temporary sensation is actually a good sign, confirming the medication is working as intended.
Okay. For more involved procedures, general anesthetic is used for major surgeries to ensure the patient remains unconscious.
This clearly differentiates general anesthesia from local. General anesthetic is purposefully employed to induce full-body insensitivity and unconsciousness for invasive operations. Its core purpose is to ensure complete patient comfort and safety during critical, lengthy, or highly invasive procedures, allowing surgeons to operate without the patient experiencing any sensation or awareness whatsoever.
And for a more targeted approach, local anesthetic allowed the dentist to extract the tooth without causing discomfort.
Exactly. This highlights its incredibly targeted application. Local anesthetic specifically blocks pain signals in a defined area, like a single tooth or a small patch of skin, while allowing the patient to remain fully awake and aware. It provides focused pain control, making localized procedures manageable and comfortable for the patient without the systemic effects that come with general anesthesia.
So it's really about tailoring the level of unfeeling to the procedure, from a simple numbing injection at the dentist to a complete temporary unconsciousness for major surgery. Anesthetics are fascinating tools. They essentially allow us to temporarily switch off pain, enabling medical interventions that would otherwise be, well, unbearable.
Precisely. They are cornerstones of modern medicine, fundamentally transforming surgical capabilities and patient experience.
Our next noun brings us into the realm of genetics and emergency response.
Blood.
Type.
Blood type. It refers to any of the specific classifications into which human blood is divided. This classification is primarily based on the presence or absence of particular antigens on the surface of red blood cells. Common synonyms include blood group, ABO classification, and Rh factor type, all of which underscore the precise scientific basis of these critical categorizations.
Here's a first example that many might not consider. A child's blood type is determined by the combination of their parents' blood types following specific genetic rules.
Yeah, this helps us understand the fascinating patterns of inheritance. Understanding blood type in this context is crucial for discussions around genetics in family health planning, like predicting potential blood types of offspring, or perhaps even more critically, the necessity of compatibility testing for various medical procedures, like organ donation, where genetic matches are absolutely vital.
Vital indeed. In emergency situations, it becomes incredibly urgent. Donors must match the recipient's blood type to avoid transfusion reactions.
Oh, absolutely critical. This applies the term directly to emergency medicine, stressing its critical importance in ensuring safe blood transfers during surgeries, accidents, or any other medical emergency. A mismatch in blood types during a transfusion can lead to severe and potentially life-threatening adverse reactions, making accurate typing an urgent, immediate priority for healthcare professionals.
And looking ahead, it seems to have a role in personalized health. Knowing your blood type can be crucial in personalized medicine and diet recommendations.
That's an interesting extension. It points towards wellness and the emerging field of personalized health. While research in this area is still unfolding, this classification could potentially influence tailored health advice or very specific nutritional strategies. It hints at a future where individualized care is increasingly guided by unique biological markers like your specific blood type.
So from predicting family traits to life-saving transfusions and even future personalized diet plans, blood type is far more than just a label on a medical chart. It's a fundamental biological identifier with profound implications. It's truly a personalized marker we all carry.
Indeed, it's a tiny but mighty piece of our genetic puzzle that influences so much of our health interaction.
Next, a common household item that gained significant public attention during the pandemic. Thermometer.
The thermometer. It's a device primarily used to measure temperature, most commonly body temperature, often to assess for fever or other abnormal readings. Its common synonyms include pyrometer, temperature gauge, and clinical thermometer, though the latter two specifically denote its use in a healthcare context, obviously.
What's interesting is it's not just for people, right? The chef used a candy thermometer to monitor the temperature of the caramel sauce as it cooked.
Yeah, exactly. This example cleverly adapts the term to a non-medical field, illustrating its precision in culinary processes. In cooking, a thermometer ensures optimal texture and consistency, preventing burning or undercooking. It demonstrates the device's broader application as a precise measuring tool, far beyond merely human health, showing its versatility.
But back to health, and often right in our homes. Digital thermometers provide quick readings for home health monitoring.
This puts its use in the context of modern technology. Digital thermometers offer remarkable ease of use and accessibility for everyday individuals, allowing them to quickly and accurately detect illnesses like infections early. This empowers individuals to monitor their own health effectively and make timely decisions about seeking medical advice.
And as you mentioned, recently its public health role grew immensely. Infrared thermometers were widely used during the pandemic for contactless screenings.
Oh, absolutely. This example directly links the tool to public health measures during crises. Infrared thermometers became critical for rapid, hygienic temperature checks in crowded environments, enabling quick identification of potentially feverish individuals without any direct contact. They played a significant part in containing the spread of communicable diseases on a wide scale. Really quite remarkable.
It is remarkable how a seemingly simple device, from making perfect caramel to detecting illness at home and on a public scale, became a frontline tool during a global health crisis. It truly highlights how basic technology can have widespread impact.
Absolutely. The simple act of temperature monitoring, once confined to sick beds, became a vital component of global public health strategy.
Moving on now to Crutch.
Okay, Crutch. It's typically one of a pair of sticks that people with movement difficulties use for support under their arms to help them walk or stand. Synonyms like support aid, walking stick, and mobility crutch all emphasize its fundamental role in assisting locomotion and providing stability to individuals with impaired mobility.
You'll frequently hear this in a recovery context. He leaned heavily on the crutch as he made his way down the hospital corridor, recovering from surgery.
Yes, that vividly depicts its use in post-operative recovery. The crutch provides essential support, bearing weight and aiding balance, as a patient gradually regains mobility after an injury or surgery. It's a crucial tool in facilitating the patient's often challenging journey towards greater independence and full physical recovery.
In physical therapy settings, there's a specific need. Adjustable crutches are essential for patients with varying heights during rehabilitation.
That's right. This places the term squarely in the context of physical therapy, highlighting the critical importance of customization. Adjustable crutches ensure optimal patient comfort and effective weight distribution, which are absolutely vital for proper gait training and preventing any further injury during the rehabilitation process. It allows for tailored and effective support.
And for athletes, it's a familiar sight, unfortunately sometimes. Athletes sometimes rely on crutches after spraining an ankle in competition.
Yes. This applies its usage specifically to sports injuries. Crutches provide temporary aid, allowing athletes to avoid putting excessive strain or weight on an injured limb, like a sprained ankle, while it heals. This temporary assistance is crucial for preventing aggravation of the injury and ensuring a proper, timely athletic recovery, getting them back in the game sooner.
So whether it's post-op recovery, a tailored rehabilitation program, or temporary aid for an athlete, the crutch symbolizes that vital period of support, where we lean on something external to regain our internal strength. It's a bridge to mobility.
It's indeed a potent symbol of recovery and adaptation, highlighting the temporary nature of many physical challenges.
Next, a word that describes a fundamental process we all undergo: healing.
Healing. It's defined as the process of becoming healthy again after an injury or illness. Synonyms include recovery, mending, and restoration, each carrying nuanced implications about the type and completeness of the return to a state of full health.
In therapeutic settings, it's a core focus. Physical therapy plays a crucial role in facilitating the healing of sports injuries.
Yes, this illustrates the term in therapeutic contexts. Guided exercises and targeted interventions in physical therapy actively accelerate tissue repair and restore function after physical trauma. It's not just about passively waiting for the body to mend, it's about actively working towards that restoration and regaining full physical capabilities.
Moving beyond the physical, this concept applies profoundly to our minds. Emotional healing after loss requires time and support from loved ones.
That's a very important point. This expands the concept significantly to mental health. It portrays the gradual and often complex resolution of grief or psychological distress, not necessarily through physical repair, but through psychological means, and the absolute necessity of a nurturing, supportive environment. It profoundly emphasizes that healing encompasses the mind and spirit as much as the body.
And holistically, we often talk about natural healing processes can be boosted by a balanced diet and rest.
This emphasizes holistic approaches to well-being. It links fundamental lifestyle choices, such as good nutrition and adequate rest, directly to the body's innate repair mechanisms. This highlights the profound importance of overall well-being and actively supporting the body's natural ability to recover and maintain health.
So, from a torn muscle recovering with physical therapy, to the quiet mending of a broken heart, to simply getting enough sleep to help your body repair itself. Healing truly is a multifaceted, often quiet, and deeply personal journey back to wholeness. It's a testament to the body's incredible resilience.
Precisely. It encompasses not just biological repair, but psychological and emotional restoration, often with a subtle interplay between all those dimensions.
Our next term brings us into the formal structures of healthcare: hospitalization.
Hospitalization. It refers to the fact or the period of being placed in a hospital for medical treatment. Synonyms include inpatient care, admission, and institutional treatment, all conveying the clear idea of receiving care within a dedicated, structured medical facility.
For instance, the hospital provided excellent care during her hospitalization, ensuring she received round-the-clock attention.
Yes, this highlights the concept of comprehensive monitoring. It illustrates scenarios where the term signifies a period requiring intensive medical oversight and constant vigilant attention, which is absolutely crucial for achieving optimal patient outcomes, especially in complex or critical health situations where every moment counts.
We often hear about potential downsides, though. Prolonged hospitalization can lead to increased risks of secondary infections.
That's a very real concern. This addresses potential complications. It focuses on the implications of extended stays in healthcare facilities, such as the heightened risk of acquiring additional, often more resistant infections. This underscores the constant need for healthcare providers to balance the benefits of inpatient care with the potential for new health challenges. It's a tricky balance sometimes.
It really is. And in urgent situations, it's immediate. Emergency hospitalization was necessary after the accident to stabilize the patient.
Right. This ties the term directly to urgent care. It shows immediate admission for life-saving interventions when a patient's condition is critical and requires swift, decisive action. This highlights the hospital's vital role as a hub for rapid response in acute medical emergencies, where timely intervention can make all the difference.
So hospitalization can mean everything from round-the-clock intensive care to a necessary risk of infection during a long stay to an immediate life-saving intervention. It's a complex, essential aspect of healthcare, embodying both advanced treatment and the challenges of institutional care.
It truly encapsulates the double-edged sword of modern medical intervention life-saving capabilities alongside inherent risks.
Now, a principle that underpins all ethical medical practice: informed consent.
Informed consent. It's essentially permission given by a patient after they have been fully informed of all possible consequences and risks of a particular treatment or procedure. Synonyms include educated agreement, voluntary authorization, and risk-acknowledged permission, all stressing the paramount importance of comprehensive understanding before any decision is made.
This is a foundational principle. Informed consent is a fundamental principle in medical ethics, ensuring patients have sufficient information to make informed decisions about their healthcare.
Absolutely foundational. This ethically frames the term. It profoundly emphasizes patient autonomy and treatment choices, underscoring the moral obligation of healthcare providers to fully educate their patients about their condition, proposed treatments, alternatives, potential risks, thereby allowing for truly independent and self-determined decision-making.
It also applies beyond just treatment in a clinical setting. Researchers must obtain informed consent from participants before starting clinical trials.
Yes, critically important there too. This applies the concept directly to scientific studies. It highlights the legal and moral requirements for voluntary involvement in research, ensuring participants understand the nature, purpose, potential benefits, and importantly, the risks of the study before they agree to participate. It upholds the highest ethical research practices.
And before surgery, it's a critical discussion. The surgeon explained the procedure thoroughly to secure informed consent.
This depicts its crucial use in preoperative discussions. It stresses the absolute need for comprehensive explanations to ensure the patient's full comprehension of both the benefits and potential dangers associated with a surgical procedure, reinforcing the patient's fundamental right to make a fully informed choice about their body and their health.
So whether it's deciding on a treatment, participating in a study, or preparing for surgery, informed consent isn't just a signature on a form. It's a powerful principle that puts the patient's autonomy and understanding at the very heart of healthcare. It highlights the shift from a maybe paternalistic model of medicine to one rooted in partnership and transparency.
Exactly. It empowers patients and transforms the healthcare dynamic into a collaborative endeavor.
Next is injection.
Injection. It's simply the act of putting a drug or other substance into a person's body using a syringe. Synonyms include shot, inoculation, and hypodermic administration, all emphasizing the method of direct delivery into the body, typically beneath the skin or into a muscle, for rapid or targeted effects.
In the sports world, it's not uncommon. The athlete received an injection before the game to manage a recurring injury.
Yeah, that vividly illustrates its use for pain relief in sports. It demonstrates the quick, localized delivery of medications, often anti-inflammatory agents, directly to the site of an injury, enabling the athlete to continue performance despite chronic or recurring discomfort. It's a common strategy for immediate symptom management.
For chronic conditions, it can be life-sustaining. Insulin injections are vital for managing diabetes in many patients.
Absolutely vital. This puts it into the critical context of chronic conditions. It emphasizes the absolute vital role of daily, often self-administered injections for blood sugar control in managing illnesses like diabetes, highlighting how essential this method of delivery is for maintaining health and preventing severe long-term complications.
And a cornerstone of preventive health. Flu injections help build immunity against seasonal viruses.
This uses the term for preventive vaccination. It highlights its significant role in widespread public health efforts to reduce the incidence and transmission of seasonal outbreaks by stimulating the body's immune response against specific viruses, protecting both individuals and communities.
So from a temporary pain block for an athlete, to a daily life-sustaining dose for a diabetes patient, to a crucial public health measure like a flu shot, injections are a remarkably versatile method of drug delivery. They're a swift, direct route to intervention.
Indeed. They bypass the digestive system, allowing for quicker absorption and more precise dosing, which is often critical in medicine.
Let's discuss placebo.
Placebo. It's a medicine or treatment without any physiological effect, given either to a control group in an experiment to measure the effectiveness of a new drug, or sometimes to patients who believe they need medicine when they don't. Synonyms include dummy pill, sham treatment, and inert substance, all indicating a non-active intervention.
In research, it's incredibly crucial. Placebo-controlled studies help researchers determine if the observed effects of a new treatment are due to the medication's pharmacological properties or psychological factors.
Oh, absolutely critical in research methodology. By contrasting real drugs with non-active ones, researchers can meticulously isolate specific therapeutic effects from psychological influences, ensuring that any perceived benefits are genuinely due to the active compound and not simply the patient's expectation or belief in treatment.
It speaks profoundly to the mind-body connection, doesn't it?
Yeah.
Some patients experience symptom relief from a placebo due to the power of suggestion.
It really does. This highlights the fascinating and sometimes mystifying mind-body connection. It shows how belief and expectation can genuinely mimic actual therapeutic outcomes, a phenomenon we call the placebo effect. This powerful effect truly underscores the intricate relationship between our mental state and our physical well-being. It's quite amazing, actually.
It is. But there are significant considerations, especially with serious illnesses. Ethical concerns arise when using placebos in trials for serious illnesses.
Yes, that's a major ethical consideration. This addresses the profound moral dilemmas inherent in withholding active treatment from patients suffering from severe conditions, even for the sake of scientific validity. It raises important questions about patient welfare, the balance between research integrity and compassionate care, prompting ongoing discussion within the medical community about when and how placebos can ethically be used.
The fascinating thing about the placebo effect isn't just that it works, but that it challenges us to reconsider the boundaries of medical treatment itself. It suggests that the power of expectation can sometimes be a potent, albeit ethically complex, therapeutic tool. It pushes us to think about healing in broader terms than just chemical reactions.
It certainly does. It forces us to acknowledge the inherent power of human belief and the complex interplay of biological and psychological factors in health.
Next, remedy.
Remedy. It's a treatment or medicine for a disease or to reduce pain that is not severe. Synonyms include cure, antidote, and palliative, though remedy often implies a less potent or less severe ailment, suggesting relief or comfort rather than a definitive cure for a major illness.
In alternative medicine, you'll hear this often. The herbalist suggested a remedy made from chamomile and lavender to promote relaxation and sleep.
Yes. This beautifully portrays its use in alternative medicine. It focuses on natural ingredients and traditional preparations for the gentle relief of mild conditions such as insomnia. These remedies often emphasize holistic well-being over pharmaceutical intervention, aligning with a more natural approach to health.
For self-care, this is a common term. Over-the-counter remedies can alleviate common cold symptoms effectively.
Right. This applies the term directly to self-care, emphasizing readily accessible options for managing non-serious ailments without requiring a doctor's prescription. These remedies offer symptomatic relief, allowing individuals to manage minor discomforts and inconveniences independently. Just pop down to the pharmacy.
Exactly. And culturally, it's deeply rooted. Traditional remedies often incorporate cultural practices passed down generations.
Yes, this delves into ethnomedicine, linking historical knowledge and deep cultural practices to traditional approaches in symptom management. It highlights the diverse and often deeply rooted ways different societies have sought relief and healing through generations, showing the rich tapestry of human health practices.
So, whether it's a soothing herbal tea, a readily available pain reliever, or a time-honored cultural practice, a remedy is about seeking comfort and relief. It shows that healing isn't always about a dramatic cure, but often about gentle alleviation.
Indeed. It captures the everyday, accessible side of health management, often emphasizing comfort and support over aggressive intervention.
Next specimen.
Specimen. It's a small amount of bodily fluid or tissue taken for examination. Synonyms include sample, test material, and biological extract, all referring to a small, representative portion used for diagnostic or analytical purposes in a medical or scientific context.
In diagnostic processes, it's fundamental. A specimen was sent to the laboratory for testing to determine the patient's cholesterol levels.
Yes, fundamental is the right word. This clearly illustrates diagnostic processes. It details precisely how bodily fluids, like blood, are used for comprehensive health metrics analysis. This analysis is crucial for understanding a patient's physiological state, identifying risk factors, and vitally guiding subsequent treatment decisions.
In the critical field of oncology, it's indispensable. Pathologists analyze tissue specimens to diagnose cancers accurately.
Indispensable, absolutely. This places it in the crucial context of oncology. Pathologists microscopically examine tissue specimens for the precise identification and staging of diseases like cancer. This makes it an absolutely indispensable step for accurate diagnosis and for determining the most appropriate and effective course of treatment.
And for preventive care, it's routine. Collecting a urine specimen is standard in routine checkups for infections.
This ties its usage directly to preventive screenings. It shows how non-invasive methods like collecting a urine sample enable the early detection of various infections or other health abnormalities during routine health assessments, allowing for timely intervention and treatment before conditions worsen.
So, from a quick blood draw for cholesterol, to a microscopic examination for cancer, to a routine urine test, the simple act of taking a specimen is what makes precise diagnosis and preventive care possible. It's the silent workhorse of modern medicine.
Without these tiny insights, the larger picture of our health would remain a mystery. It underscores the profound importance of clinical pathology.
Let's move to nose job.
Okay, nose job. It's a surgical procedure specifically performed to change the appearance of someone's nose for aesthetic reasons. More formal synonyms include rhinoplasty, nasal reconstruction, and cosmetic nose surgery, reflecting both its medical and, well, reconstructive nature.
For anyone considering this, postoperative care is key. Recovery from a nose job typically involves swelling and discomfort for the first few weeks.
Yes, that covers the very real realities of postoperative care. It emphasizes the common physical side effects associated with aesthetic enhancements, like swelling and bruising, and outlines the typical recovery timeline. Helping to prepare patients for the initial period of healing after the procedure, it's not an instant fix.
Right. You often hear about it as an elective procedure.
Many celebrities opt for a nose job to refine their facial features.
This applies the term to elective procedures. It illustrates the significant influence of societal perceptions and cultural trends on body image and aesthetic choices, showing how individuals, particularly those in the public eye, may seek to align their appearance with perceived ideals of beauty.
But it can also have a dual purpose, right? Functional nose jobs can also correct breathing issues alongside cosmetic changes. That's a really important distinction. This highlights its fascinating combined medical and aesthetic purposes. It addresses how these procedures can concurrently rectify structural defects, like a deviated septum, a common issue causing breathing difficulties alongside achieving desired cosmetic improvements. So it offers both functional relief and aesthetic benefits in one go.
So whether it's for purely aesthetic reasons, influenced by trends, or for a combination of cosmetic and functional improvements like fixing a deviated septum, a nose job is a powerful example of how medicine can intersect with personal image and quality of life.
It speaks to the evolving nature of healthcare, where physical well-being often intersects with self-perception and confidence.
Next, a core figure in our healthcare system: physician.
Physician, a medical doctor who primarily specializes in general medicine, distinct from a surgeon. Synonyms like doctor, general practitioner, or GP, and internist each specify slightly different roles within the broader medical field, often indicating their primary area of focus.
Regarding interpersonal aspects, their bedside manner is vital. The physician's bedside manner and communication skills are crucial in building trust with patients.
Oh, absolutely crucial. This really stresses the incredibly important interpersonal aspects of medical practice. It demonstrates how empathy, clear and compassionate communication, and a comforting demeanor are paramount in fostering strong, trusting patient-doctor relationships, which are foundational for effective care and encouraging patient compliance with treatment plans.
Their role in healthcare systems is quite broad. Primary care physicians handle a wide range of health concerns before referring to specialists.
Yes, they're often the first point of contact. This defines their critical roles within healthcare systems. It emphasizes their function in initial diagnosis, management of a broad spectrum of health issues, and importantly, serving as the crucial coordinator of care before specialist intervention is needed. They are the front line, really.
Definitely. And concerning access to care, they are key. Rural areas often face shortages of qualified physicians for community health needs.
That's a significant issue. This puts the term into the context of access issues. It links the availability of healthcare professionals directly to broader public health policy and the pursuit of equitable healthcare distribution, highlighting how disparities in physician presence can significantly impact community health outcomes and overall well-being.
So from the crucial rapport building with patients, to acting as the gatekeepers of general health, to addressing critical shortages in underserved areas, physicians are truly the bedrock of our healthcare system. They're more than just diagnosticians. They're often trusted confidants.
They are indeed central to individual and community health, serving as both healers and navigators within complex systems.
Moving on to caregiver.
Caregiver, someone who looks after a child or an old, sick, or disabled person, often at home. Synonyms like carer, attendant, and guardian all denote a personal and often intimate role in providing sustained support and assistance, typically for someone who cannot fully care for themselves.
In chronic care, they are indispensable. The support group offers resources and advice for caregivers of individuals with Alzheimer's disease.
Indispensable is right. This directly addresses the unique challenges of chronic care. It details the immense emotional and practical aid provided to those in long-term caregiving roles, particularly for debilitating conditions like Alzheimer's, underscoring the vital need for external support networks to sustain the caregivers themselves. It's a demanding role.
It is. The role can also be highly professionalized. Professional caregivers undergo training to handle medical emergencies at home.
This highlights the professionalized aspect of caregiving. It emphasizes the specific skills and certifications required for daily assistance, personal care, and crucially, the ability to respond effectively to home-based medical crises, thereby ensuring a higher and safer standard of care.
And often, it's an informal role, deeply personal. Family caregivers often balance work and personal life while providing support.
Yes, and this explores the very real realities of informal roles. It focuses on the significant challenges family members face in balancing their professional responsibilities and personal life with unpaid familial duties, often leading to considerable stress, emotional strain, and even burnout. It's a huge commitment.
It really is. So whether it's the invaluable support for chronic conditions like Alzheimer's, the trained expertise of a professional, or the profound sacrifice of family members, caregivers are truly the unsung heroes of health. They provide the consistent, intimate support that makes independent living possible for so many.
They are the backbone of long-term care, often working silently to uphold the dignity and well-being of others.
Our next noun speaks to both physical and mental resilience. Stamina.
Stamina. It refers to the mental or physical strength required to continue a difficult task or effort for a long time. Synonyms like endurance, resilience, and staying power all highlight the capacity for sustained effort, encompassing both the physical exertion of the body and the mental fortitude of the mind.
In physical arts, it's paramount. The long hours of rehearsals tested the dancer's stamina, but they delivered a flawless performance.
Oh, absolutely. This vividly applies the term to physical arts, illustrating the sustained energy and immense physical demand required in rigorous activities like dance. It shows how immense physical endurance is necessary to achieve peak performance over extended periods, pushing the limits of the human body.
For overall wellness, it's a key indicator. Building stamina through regular exercise improves overall health and vitality.
Yes, it connects directly to fitness and general wellness. It highlights how consistent physical training leads to an enhanced capacity for prolonged physical efforts, ultimately contributing to improved overall life quality, consistently higher energy levels, and significantly reduced fatigue in daily activities.
And beyond the physical, it's crucial in many professions. Mental stamina is key for professionals in high-stress jobs like emergency response.
That's a great example. This powerfully shifts the focus to psychological endurance. It emphasizes the critical ability to maintain focus, composure, and sound decision-making capacity under intense pressure in incredibly demanding professional environments. It illustrates that strength of mind is just as crucial as physical strength in these roles.
So from a dancer's long rehearsal to the vitality gained from a workout to the mental grit of an emergency responder, stamina isn't just about physical endurance. It's about the deep well of energy, both physical and mental, that allows us to persist and perform under pressure. It's truly a measure of our resilience.
It's the fuel that allows us to push past perceived limits in body and mind.
No, trauma.
Trauma. It's a medical condition of the mind caused by extreme shock, which can potentially last a very long time. Synonyms include psychological injury, emotional wound, and post-traumatic stress, all strongly indicating a serious and often enduring impact on individuals' mental well-being and functioning.
From environmental events, it can be deeply impactful. Witnessing a natural disaster can leave survivors with lasting trauma and fear.
Yes. This ties the term directly to environmental events, powerfully illustrating the profound and often long-term emotional impacts that extreme events like natural disasters can inflict on survivors. It speaks to the deep psychological scars that can be left by overwhelming and terrifying experiences.
And its origins can be developmental. Therapy helps process childhood trauma to foster healthier adult relationships.
That's a critical application. This addresses developmental origins, explaining how therapeutic interventions are absolutely crucial for resolving past psychological injuries stemming from early life experiences. Processing this trauma is vital for improving future relational health and overall adult functioning, allowing for a healthier trajectory.
In military contexts, it's a significant challenge. Combat veterans often seek support for war-related trauma.
Yes, sadly common. This links the term directly to military experiences, highlighting the critical need for specialized care and support for individuals suffering from conditions like PTSD, post-traumatic stress disorder, which are related to combat exposure. It acknowledges the unique and profound psychological burdens carried by those who have experienced warfare.
So whether it's the lingering fear after a natural disaster, the deep impact of childhood experiences, or the very real scars of war, trauma is a word that describes profound psychological wounds. It reminds us that healing the mind can be as complex and vital as healing the body.
It's a testament to the mind's vulnerability, but also its incredible capacity for resilience and recovery, given the right support.
Our next noun brings us into a concerning state of mental health. Breakdown.
Breakdown. It refers to a condition in which a person becomes so intensely anxious or depressed that they can no longer handle their everyday life. Synonyms include nervous collapse, mental crisis, and emotional meltdown, all describing a severe state of mental incapacitation where normal functioning ceases.
In educational settings, it can be a stark reality. The intense academic pressure during finals week caused several students to experience breakdowns.
Yeah, unfortunately. This powerfully relates the term to educational stress. It illustrates how acute episodes of mental health crisis can result from overwhelming academic demands and prolonged, intense pressure, leading to an inability to cope with daily tasks and responsibilities, even seemingly simple ones.
But prevention is a key focus. Early intervention can prevent a full emotional breakdown in high-risk individuals.
Absolutely. Prevention is key. This strongly emphasizes the concept of prevention. It links timely counseling, psychological support, and proactive mental health strategies to averting severe disruptions in mental health for those identified as vulnerable, truly highlighting the importance of addressing distress before it escalates to a full crisis.
And increasingly, it's a concern in professional life. Work-related breakdowns are increasingly common in fast-paced corporate environments.
This applies the term to professional life. It highlights the growing prevalence of burnout and emotional crises resulting from excessive demands, intense competition, and high-pressure situations characteristic of many modern work settings, where the line between dedication and exhaustion can blur dangerously.
So whether it's triggered by academic pressure, prevented by timely support, or a consequence of relentless corporate demands, a breakdown highlights the fragile line of our mental resilience. It's a stark reminder that our minds, like our bodies, have limits and require care.
It's a critical term in recognizing the boundaries of human capacity for stress and the growing need for mental well-being support across all life stages.
Now, hygiene.
Hygiene. It refers to the crucial steps one takes to promote health and avoid disease, particularly through cleanliness. Synonyms like sanitation, cleanliness, and personal care all emphasize the essential preventive aspect of maintaining health through diligent and consistent clean practices.
For preventive behaviors, it's fundamental. Hygiene practices, such as covering your mouth when coughing, can help reduce the transmission of illnesses.
So fundamental. This strongly promotes preventive behaviors, illustrating the immense importance of basic social etiquette and fundamental practices in effectively controlling the spread of disease within communities. Simple acts of cleanliness can have a profound and widespread public health impact. Things we learned as kids, really.
Exactly. Focusing specifically on oral health. Dental hygiene routines prevent cavities and gum disease over time.
Yes, focusing in. This zeroes in on oral health, emphasizing how consistent daily habits like thorough brushing and regular flossing contribute significantly to long-term dental benefits and the effective prevention of common ailments like cavities and gingivitis, ensuring a healthy mouth throughout life.
And in institutional settings, it's paramount. Hospital hygiene protocols are strict to minimize infection risks.
Absolutely paramount there. This highlights critical institutional standards. It directly links rigorous cleaning and sterilization standards in healthcare settings to the paramount goal of patient safety and infection control, underscoring the vital role of hygiene in preventing healthcare-associated infections, which can be, well, life-threatening.
So whether it's covering a cough to protect others, a daily dental routine for healthy gums, or the rigorous standards of a hospital, hygiene is far more than just being clean. It's a proactive, collective act of health preservation, often preventing widespread issues before they even begin.
It's the silent, continuous battle against unseen pathogens, essential for both individual wellness and public safety.
Our next term, a bit more poetic perhaps, the blues.
Ah, the blues. It refers to a feeling of sadness or depression, often mild and temporary. Synonyms like melancholy, doldrums, and low spirits all highlight their transient and generally less severe nature compared to clinical depression, implying a passing mood rather than a persistent condition.
You might hear it like this, describing transient mood dips.
A case of the blues made it hard to get out of bed.
Yeah, that vividly depicts transient mood dips, showing how these temporary feelings of sadness, while not severe enough to be clinical depression, can still significantly influence daily motivation, energy levels, and overall enthusiasm for life, making even simple tasks feel difficult and unappealing. With seasonal influences, it's a familiar pattern for some. Winter blues can be alleviated with light therapy and exercise.
This connects the term directly to seasonal influences. It illustrates various effective remedies for weather-induced sadness, like light therapy, which mimics sunlight, or engaging in regular physical activity, both of which can significantly boost mood and energy during the darker, colder months.
And when it comes to coping strategies, it's often about simple things. Listening to music often lifts the post-holiday blues.
That's a good one. This ties the term to specific events, emphasizing simple and readily accessible coping strategies for managing fleeting periods of depression or sadness that can follow significant occasions, like holidays. It highlights how personal preferences and simple joys can play a powerful role in mood regulation.
So from a momentary struggle to get out of bed, to the seasonal impact of winter, to the quiet aftermath of a celebration, the blues describes those passing clouds of sadness we all experience. It reminds us that our emotional landscape is dynamic and often responsive to simple, everyday remedies.
It highlights the fluidity of mood and the often simple yet effective strategies for navigating those emotional ebbs.
Finally, for our nouns section, a truly profound concept: consciousness.
Consciousness. It's the state or quality of being awake and capable of perception, thought, and response. Synonyms include awareness, sentience, and wakefulness, all emphasizing the full range of cognitive and sensory abilities that define being fully present and engaged with the world. It's huge.
It is huge.
We often discuss unconscious states in medical settings. During surgery, anesthesia induces a temporary loss of consciousness to ensure painless procedures.
Right. This effectively contrasts consciousness with unconscious states, highlighting how medical interventions can precisely control and temporarily suspend awareness for patient safety and comfort during surgical procedures, ensuring no pain or memory of the event, a remarkable feat of modern medicine.
It also speaks to profound psychological awareness. Meditation enhances self-consciousness and mindfulness in daily life. Yes. This importantly shifts the usage to psychological awareness. It links practices like meditation to heightened self-perception and a deeper, more present awareness in everyday experiences, fostering a greater understanding of one's own thoughts, feelings, and sensations, leading to a richer inner life.
And in a recovery-oriented context, regaining consciousness after a faint requires careful monitoring.
Yes, absolutely. This places the term in a crucial recovery-oriented context, emphasizing the necessity of meticulous post-incident health checks when an individual regains awareness after a period of unconsciousness, ensuring there are no underlying complications or lingering effects that need medical attention.
So from the deliberate loss of consciousness during surgery, to the heightened awareness cultivated through meditation, to the critical moment of regaining it after a faint, consciousness is not a static state. It's a dynamic, multifaceted concept that bridges biology, psychology, and our very experience of being.
It's the ultimate frontier of both neuroscience and philosophy, defining our very existence and interaction with the world.
Okay, transitioning from the nouns that describe the elements of health, let's now explore some crucial verbs, the actions and processes that define health practices. We're starting with to administer.
Right, to administer. It means, quite simply, to give someone medicine or drugs. Synonyms include dispense, apply, and provide, all focusing on the act of delivery, particularly in a structured, professional, and often precise context.
In animal care, it's a routine. The veterinarian administered the vaccine to the dog during its annual checkup.
Yes, that clearly illustrates its use in professional animal care, focusing on ensuring preventative health through the accurate and timely delivery of treatments. It highlights the systematic and precise way medical professionals deliver interventions, whether to humans or animals.
In emergencies, it's swift and critical. Paramedics administer first aid at accident scenes to stabilize victims.
Oh, definitely critical. This emphasizes its critical use in emergency situations. It highlights the urgent and critical nature of immediate therapeutic actions undertaken to stabilize victims at accident sites, where swift and effective administration of care can genuinely be life-saving.
And in routine hospital care, precision is key. Nurses administer medications according to precise schedules in hospitals.
Precision is absolutely key there. This highlights its routine yet vital application in healthcare settings, stressing the paramount importance of accuracy in dosage and timing for the optimal efficacy of hospital treatments, and of course, paramount patient safety.
So whether it's a vet giving a vaccine, paramedic stabilizing a patient, or a nurse meticulously dosing medication, to administer is a verb that speaks to precision and responsibility in delivering care. It's about ensuring the right treatment gets to the right place at the right time.
It's the action that brings theory into practice, directly impacting health outcomes.
Next, to cleanse.
To cleanse. It means to completely clean something, especially the skin, often with a sense of purification or renewal. Synonyms like purify, detoxify, and wash imply a thorough and often beneficial cleaning process, aiming for a deeper level of cleanliness than just a simple wash.
In beauty routines, it's a foundational step. She cleanses her face using a gentle cleanser before applying skincare products.
Right. Very common there. This applies the term directly to beauty routines, focusing on the meticulous process of removing impurities, makeup, and environmental pollutants from the skin. This thorough cleansing is crucial for maintaining healthy, clear, and radiant skin, preparing it for subsequent care.
In medical use, it's critical. Antiseptics cleanse wounds to prevent bacterial infection.
Yes. Critical indeed. This explains its critical medical application, specifically emphasizing the vital role of sterilization in injury care. Thorough cleansing of a wound with antiseptics is absolutely essential to prevent the onset or spread of bacterial infections, thereby facilitating proper and unhindered healing.
And from a holistic wellness perspective, herbal teas can cleanse the digestive system naturally.
That's a different angle. This brings in a holistic perspective, illustrating the concept of internal purification for overall wellness. This idea is often associated with natural remedies that support the body's innate detoxification processes, promoting a sense of internal balance and well-being.
So, from a thorough face wash to sterile wound care, to even the idea of internally detoxifying with herbal tea to cleanse, is about a deliberate, often gentle act of purification. It's about removing impurities to promote health and well-being.
It's the act of resetting, whether externally or internally, to optimize the body's natural functions.
Now, To diagnose.
To diagnose. It means to find out the cause of a problem or disease by carefully examining symptoms. Synonyms include identify, detect, and determine, all strongly highlighting the investigative, analytical, and problem-solving nature of the process. It's like being a detective.
A health detective. Based on symptoms, it's the starting point. Experts diagnose conditions based on observable symptoms.
Yes, that's the foundation. This emphasizes symptom-based analysis as the absolute foundation of initial medical assessments. Careful observation of a patient's reported and visible symptoms leads to preliminary conclusions, guiding further investigation and shaping the diagnostic pathway.
Incorporating technology has revolutionized this. Advanced imaging helps diagnose internal injuries accurately.
Oh, tremendously. This discusses the crucial role of technology. Advanced imaging techniques like MRI or CT scans significantly enhance precision and accuracy in detecting internal injuries or conditions that might otherwise be missed, offering a clearer picture within the body. It's remarkable.
And in psychological context, it's a nuanced process. Psychiatrists diagnose mental disorders through comprehensive evaluations.
Very nuanced. This places the term in a profound psychological context, linking detailed interviews, behavioral observations, and specific psychological tests to the meticulous identification of complex mental health conditions, requiring a multifaceted and highly sensitive approach.
So whether it's a doctor interpreting symptoms, an MRI revealing an internal injury, or a psychiatrist unraveling a complex mental health condition, to diagnose is about solving a health puzzle. It's the vital first step that directs all subsequent treatment.
It's the Sherlock Holmes of medicine, piecing together clues to reveal the underlying truth about an illness.
Next, to vaccinate.
To vaccinate. It means to protect a person or an animal against a disease by giving them a preventive shot that stimulates their immune system against specific diseases. Synonyms like inoculate, immunize, and inject all focus on this vital preventive action of building an immune response.
For travel health, it's a wise precaution. Before traveling abroad, it is advisable to visit a clinic to vaccinate against region-specific infections.
Very wise. This ties the term directly to travel health, highlighting the importance of proactive measures to prevent exposure to and contraction of exotic or region-specific diseases in foreign lands, safeguarding global travelers from unfamiliar pathogens.
In public policy, it's a collective effort. Schools require students to vaccinate before enrollment to maintain herd immunity.
Yes, a crucial public health measure. This addresses public policy. It powerfully emphasizes the collective protection that widespread vaccinations provide for the entire community, particularly vulnerable populations who cannot be vaccinated themselves. It illustrates the profound societal benefit that extends far beyond individual protection.
And agricultural health depends on it. Veterinarians vaccinate livestock to control outbreaks on farms.
This applies it directly to agricultural health, highlighting its crucial role in managing animal health, preventing widespread disease outbreaks within farm populations, and thereby safeguarding our food supply chains.
So whether it's protecting an individual traveler, building herd immunity for a community, or preventing outbreaks on farms, to vaccinate is a powerful verb that speaks to foresight and collective well-being. It's about proactively fortifying defenses against disease.
It's a cornerstone of preventative medicine, illustrating the profound impact of scientific foresight on global health.
Now, to admit.
To admit. When a hospital admits a patient, it means they are formally taking them in so they can receive treatment. Synonyms include hospitalize, intake, and receive, all referring to the formal process of entry into care within a medical facility, signifying a period of dedicated oversight.
Consider the transition from outpatient to inpatient care. After a thorough examination, the hospital admitted her for further tests to determine the cause of her illness.
Right. This illustrates the pivotal transition from outpatient to inpatient care, detailing the process where a comprehensive examination or initial assessment leads to a decision for formal admission to the hospital, for further diagnostics or ongoing, more intensive treatment.
For urgent cases, it's immediate. Emergency rooms admit critical cases immediately upon arrival.
Absolutely immediate. This emphasizes the sheer urgency involved. It highlights how life-threatening conditions are prioritized for immediate admission and rapid intervention in emergency settings, where every single moment counts in stabilizing a patient and potentially saving their life.
And mental health admissions carry unique considerations. Psychiatric facilities admit patients voluntarily or involuntarily based on needs.
Yes, that's a complex area. This focuses on mental health-oriented admissions, addressing the complex considerations of patient consent in the context of psychiatric care. It highlights the delicate balance between individual autonomy and acute needs for safety and treatment, sometimes necessitating involuntary admission for severe conditions.
So whether it's moving from diagnostics to inpatient care, prioritizing a life-threatening emergency, or navigating the complexities of mental health, to admit signifies a crucial threshold where intensive structured care begins. It's the moment formal treatment takes over.
It's a gateway to focused medical care, reflecting a profound commitment to patient well-being, whatever the circumstances.
Next, a verb that often indicates a problem. To discharge.
Yes, to discharge. When a wound or body part discharges, it means it is slowly releasing an infectious liquid, typically pus. Synonyms like ooze, exude, and seep emphasize the gradual release of fluid, often indicating an underlying issue, particularly an infection. Not always, but often.
Right. For infection management, it's a key observation. The wound care team regularly cleaned and dressed the wound to minimize the risk of discharging pus.
Yes, key observation. This focuses on critical infection management, detailing the crucial steps taken by healthcare professionals to prevent complications arising from the release of infectious fluids from wounds. This is absolutely crucial for preventing the spread of infection and promoting proper healing.
As a clear sign of neglect or worsening condition, infected abscesses may discharge foul-smelling fluid if untreated.
That's a definite warning sign. This powerfully warns of the consequences of neglect. It illustrates how the discharge of specific fluids, particularly if foul-smelling, can serve as a clear indicator of unchecked bacterial activity, and the urgent need for immediate medical intervention to prevent further complications or systemic issues.
But sometimes it's a normal part of healing, right? Post-surgical sites sometimes discharge clear fluid during healing.
That's important to note, yes. This importantly differentiates normal healing from infection. It explains that clear fluid discharge, often called serous fluid, is a natural and expected part of the recovery process after surgery, distinguishing benign physiological responses from infectious releases, which would typically involve pus, blood, or other abnormal fluids.
So whether it's a warning sign of infection, a consequence of neglect, or a normal part of healing, to discharge, as a verb describes a vital release of fluid from the body. It's a key indicator for medical professionals in monitoring recovery or detecting problems.
It's a subtle but significant diagnostic clue, often indicating the body's internal state.
Now, to immunize.
To immunize. It means to protect an animal or a person from a disease by vaccination, strengthening their immune system. Very similar to vaccinate, but perhaps emphasizes the resulting protection more. Synonyms include vaccinate, inoculate, and safeguard, all emphasizing the protective action achieved through stimulating the body's immune system to build resistance.
In animal welfare, it's widely recommended. Veterinarians recommend pet owners immunize their dogs and cats to prevent the spread of certain diseases.
Yes, very common recommendation. This directly applies the term to animal welfare, highlighting its crucial role in curbing zoonotic risks, those diseases transmissible from animals to humans, and maintaining the overall health of domestic animals, contributing to both animal and human health.
For public health campaigns, it's a global effort. Global campaigns aim to immunize children against polio worldwide.
A huge success story, mostly. This focuses on expansive public health campaigns, emphasizing large-scale, coordinated international efforts aimed at disease eradication, such as the ambitious global fight against polio. It truly showcases the power of collective action in achieving widespread health objectives.
And for lifelong immunity, it's a continuous process. Boosters immunize adults against waning childhood protections.
That's right, it's not just for kids. This highlights its lifelong application. It underscores the vital importance of revaccination through booster shots to maintain sustained immunity, as protections gained from childhood vaccinations may diminish over time, ensuring ongoing defense against preventable diseases throughout adulthood.
So, from protecting beloved pets, to eradicating global diseases, to ensuring lifelong protection for adults, to immunize, is an incredibly powerful word.
Yeah.
It speaks to foresight, scientific achievement, and a collective commitment to health across the lifespan.
It's the ultimate proactive defense, turning potential pandemics into preventable ailments.
Our next verb is to stitch.
To stitch. It means to join the edges of a wound together using a thread and needle. Synonyms like suture, sew, and close all describe the precise repair process of bringing tissues together to facilitate proper and effective healing, often with a focus on minimizing scarring. Suture is maybe the more formal medical term.
Right. For minor trauma care, it's often necessary. The doctor stitched the puncture wound on his hand after cleaning it thoroughly.
Yes, a common procedure. This clearly depicts minor trauma care. It details the importance of proper wound closure for effective healing after superficial injuries, preventing further contamination and actively aiding the body's natural repair mechanisms.
For cosmetic outcomes, it demands artistry. Plastic surgeons stitch incisions meticulously to minimize scarring.
Absolutely, artistry is involved. This strongly emphasizes its cosmetic application. It highlights the extraordinary precision and artistic skill required in plastic surgery procedures to achieve optimal aesthetic outcomes and significantly reduce visible scarring, illustrating the blend of medical necessity and reconstructive artistry.
And in emergency on-site intervention, it can be life-saving. Emergency medics stitch lacerations in the field when possible.
Yes, sometimes necessary right there. This powerfully focuses on on-site intervention. It shows how rapid medical action is taken to control bleeding and stabilize injuries directly at the scene of an accident, particularly for lacerations, before the patient can be transported to a hospital, providing crucial immediate care.
So from closing a simple wound, to the meticulous artistry of a plastic surgeon, to the rapid intervention of a medic in the field, to stitch is about more than just sewing. It's about precise repair, minimizing damage, and setting the stage for optimal healing.
It's a foundational skill, demonstrating how precise manual dexterity is paramount in medicine.
Next, to revive.
To revive, it means to make a person conscious again. Synonyms include resuscitate, awaken, and restore, all emphasizing the return to a state of awareness and vital physiological function after a period of unconsciousness or near death. Resuscitate often implies more intensive medical efforts.
Okay. For basic life support, it's a critical skill. The first aid instructor taught the class how to revive someone who has passed out due to low blood pressure.
Yeah, basic first aid. This covers basic life support techniques, specifically addressing methods for recovery from syncope or fainting caused by conditions like low blood pressure. It underscores essential, non-invasive skills for immediate assistance in common medical emergencies.
In critical interventions, it's life or death. CPR techniques can revive cardiac arrest victims if applied promptly.
Absolutely critical. This powerfully highlights critical interventions. It links immediate chest compressions and other resuscitative efforts directly to restarting vital bodily functions in cardiac arrest situations, emphasizing the time-sensitive and life-saving nature of such emergencies where every second counts.
And using sensory methods can be quick. Stimulants like ammonia salts revive fainted individuals quickly.
Right, those smelling salts. This explores chemical and sensory methods, illustrating how certain substances can rapidly restore consciousness by stimulating sensory receptors. These are often used in immediate situations where a quick response is needed to bring someone back to awareness.
So whether it's basic first aid for a faint, life-saving CPR or a quick sensory stimulant to revive, describes the dramatic act of bringing someone back from the brink of unconsciousness or even death. It's about restoring vitality.
It embodies the most urgent and direct form of medical intervention, literally breathing life back into someone.
Our next verb is to soothe.
To soothe. It means to reduce the severity of pain or discomfort, bringing comfort and relief. Synonyms include alleviate, ease, and relieve, all emphasizing the comfort provided and the lessening of distress, often through gentle means.
In physical therapy, it's a common goal. The cold compress soothes the pain and reduces swelling.
Yes, a classic example. This uses physical therapy examples, showing how simple, non-invasive remedies like cold compresses can effectively reduce inflammation, ease discomfort, and provide a sense of immediate relief following an injury or strain. It's a basic but powerful intervention.
For topical application, it's about gentle relief. Herbal ointments soothe skin irritations from allergies.
This focuses on topical applications, emphasizing the use of natural remedies or specific creams for providing localized relief from various dermatological issues caused by allergies or irritations, highlighting gentle external care that calms the skin.
And using psychological methods, its impact can be profound. Music therapy soothes anxiety in hospital patients.
That's a fascinating application. This explores profound psychological approaches, linking auditory stimuli like calming music to the reduction of pain perception and anxiety in a clinical setting. It powerfully showcases the profound influence of the mind on overall well-being and comfort, even in challenging environments.
So whether it's a cold compress on a sprain, an herbal ointment for an itch, or the calming effect of music therapy, to soothe is about bringing comfort and easing distress. It reminds us that healing isn't always aggressive. Sometimes it's about gentle relief and tranquility.
It speaks to the holistic nature of care, acknowledging that relief extends beyond just physical symptoms to emotional and psychological states.
Finally, for our verbs, a word that speaks to visible vitality: to glow.
To glow. When referring to a person's face, it means to look lively and healthy, often specifically as a result of training and exercising. Synonyms like radiate, shine, and beam all emphasize a visible vitality, a healthy appearance, and often an inner happiness that reflects outward.
For fitness regimens, it's a common outcome. Even during the toughest boot camp sessions, her face glowed with determination and focus.
Yeah, you see that intensity. This strongly ties the term to fitness regimens, illustrating the visible vitality and healthy appearance that can result from sustained physical exertion and disciplined training. It reflects both inner strength and vibrant health, even in moments of intense effort.
In wellness and aesthetics, it's a desired effect. Regular yoga makes the skin glow with improved circulation.
This connects it directly to wellness practices and aesthetic benefits, explaining how activities like yoga can significantly enhance skin health through improved circulation, bringing a natural flush and radiance to the complexion that's truly noticeable.
And after intense physical activity, it's often due to physiology. Athletes often glow after marathons, reflecting endorphin highs.
The runner's high. This highlights specific post-activity physiological responses, emphasizing the well-known runner's high and the visible physical manifestation of positive internal states after intense physical feats. It indicates a rush of beneficial hormones and increased blood flow, truly making them glow.
So whether it's the flush of determination from a tough workout, the radiant skin from good circulation through yoga, or the sheer joy of a marathoner's endorphin rush to glow, describes that visible, vibrant sign of health and well-being radiating from within. It's the visual cue of vitality.
It's the external manifestation of internal health and happiness, a truly universal sign of thriving.
Okay, we've moved through the nouns that name our health concepts and the verbs that describe health actions. Now let's round out our deep dive with some key adjectives, the words that describe and define attributes related to health. We're starting with dumb.
Right, dumb. Historically, this primarily meant unable to speak. Synonyms include mute, speechless, and voiceless, emphasizing an impairment or a temporary inability to articulate words. It's important to understand the historical context of this word, as its usage has evolved considerably and can be offensive now if used incorrectly.
Right, context is key. In a historical context, it had a different meaning than today. In historical context, the term dumb was often used to describe individuals with speech impairments or those who could not speak for various reasons.
Exactly. This historicizes the word, noting its evolution in disability discourse. It's truly important to understand how language changes and develops over time to become more respectful and precise. Moving away from terms that might now be considered offensive or inaccurate when describing individuals with disabilities, we wouldn't typically use dumb in this way now.
Good point. It can also describe certain psychological conditions. Selective mutism renders some children dumb in social settings.
Yes, in this context, it means unable to speak due to the condition. This addresses specific psychological conditions, distinguishing situations where an individual's inability to speak is related to specific psychological states, like severe anxiety. Rather than a physiological impairment of the vocal cords or brain function, it's a complex and often misunderstood condition.
Or a very acute emotional response. Trauma can leave survivors temporarily dumb from shock.
This illustrates acute emotional responses to distress. It shows how profound shock or extreme fear can temporarily render individuals speechless, a powerful physiological manifestation of intense psychological impact, where words simply cannot form and the body reacts to overwhelming stress, like being struck dumb.
So from its historical usage to describe speech impairment, to psychological conditions like selective mutism, to the sheer shock that can render someone speechless, dumb has a complex history and current nuanced meanings. It reminds us how language reflects our understanding of human conditions and how that understanding evolves.
It's a perfect example of how terms acquire different connotations over time, underscoring the importance of historical and cultural context in language.
And sensitivity.
Next, pharmaceutical.
Pharmaceutical. It's an adjective directly related to the production, use, or sale of medicines. Synonyms like medicinal, drug-related, and pharmacal all pertain to the vast industry involved in developing, manufacturing, and distributing drugs and medical treatments. For conventional treatments, it's standard. Doctors often prescribe pharmaceutical interventions to manage various medical conditions.
Yes, standard practice. This highlights conventional treatments, often contrasting them with alternative or complementary approaches. It emphasizes the central and indispensable role of manufactured medications in managing a wide array of medical conditions, from chronic illnesses to acute infections, forming the backbone of modern medicine.
In industrial innovation, it's a huge investment. Pharmaceutical companies invest heavily in research for new therapies.
Huge investment indeed. This focuses on the industrial aspect, underscoring the substantial financial investment and continuous innovation required in drug discovery and development. Bringing new therapies and life-saving medications to market is a process that can take many years and, well, billions of dollars, highlighting the scale of the industry.
And governance and safety are paramount. Regulatory bodies oversee pharmaceutical safety standards globally.
Absolutely paramount. This discusses governance and safety. It links the term directly to the critical role of regulatory oversight in ensuring the quality control, ethical conduct of trials, and safety of medicinal products worldwide, protecting public health and consumer trust in the drugs they consume.
So from a doctor's prescription to the massive R&D budgets of drug companies, to the vigilant eye of global regulators, pharmaceutical defines an entire ecosystem. It's a term that encapsulates the complex global journey from scientific discovery to patient care.
It's a vast and intricate domain, balancing innovation with stringent safety protocols to impact global health directly.
Now deaf.
Deaf describes someone who is partly or completely unable to hear. Synonyms like hearing impaired, orally challenged, and hard of hearing emphasize varying degrees of auditory impairment, acknowledging a spectrum of hearing loss from mild to profound. The term deaf with a capital D often refers to cultural identity.
Right, the cultural aspect is important. Regarding adaptation strategies, it often involves incredible resourcefulness. He learned to lip read to better understand conversations as he grew deaf.
Yes, amazing adaptation. This powerfully showcases adaptation strategies. It illustrates how individuals develop compensatory communication aids and skills, such as lip reading, to navigate progressive hearing loss, demonstrating remarkable resilience and resourcefulness in maintaining connection and comprehension.
For social and cultural aspects, it's about identity. Deaf communities advocate for sign language education in schools.
This highlights profound social and cultural aspects. It emphasizes the advocacy efforts of deaf communities to promote sign language education, reinforcing its importance not just as a distinct language, but as a cornerstone of deaf culture and identity, fostering inclusion and understanding.
And occupational health can play a role. Noise-induced deafness is preventable with ear protection.
Yes, preventable in many cases. This ties the term directly to occupational health, stressing the preventable nature of certain types of auditory loss. It underlines the crucial importance of consistent use of protective measures in noisy environments, like industrial settings, to safeguard hearing over a lifetime.
So whether it's the personal journey of adapting through lip reading, the collective advocacy for sign language, or the preventable nature of some hearing loss, deaf speaks to a spectrum of experience. It's a reminder that disability is not just a medical condition, but a lived experience with rich cultural dimensions and opportunities for adaptation.
It truly emphasizes the social model of disability, highlighting environmental and societal factors that shape the experience of hearing loss.
Finally, sighted.
Sighted means capable of seeing, typically contrasted with a blind person. Synonyms like seeing, visually able, and non-blind all emphasize visual capacity and the ability to perceive the world through sight.
In context of vigilance, it's a vital skill. The lookout sighted enemy ships approaching the harbor and raise the alarm.
Yes, a classic use. This uses the term powerfully in contexts of vigilance and observation, highlighting the essential role of visual capabilities in surveillance and detection. Here, keen eyesight is absolutely crucial for identifying threats or important details from a distance.
For inclusivity and support, it's about partnership. Sighted guides assist visually impaired individuals in navigation.
This promotes inclusivity and vital support, highlighting the collaborative roles that sighted individuals play in enabling navigation and enhancing the daily lives of those with visual impairments. It fosters independence and accessibility through direct human assistance.
And technological application often depends on it. Virtual reality simulates experiences for sighted users in training.
Right. This relates it directly to technological applications, emphasizing how visual capabilities are fundamental to how users interact with and benefit from sophisticated simulations, such as those used in virtual reality training environments, which rely heavily on visual input for immersive experiences.
So whether it's the vigilance of a lookout, the supportive role of a guide, or the immersive experience of virtual reality, sighted defines a core human sense in its vast implications. It's about how we perceive our world, both independently and with the support of others.
It's the foundational sense for much of our interaction with the environment and technology, underscoring its profound importance in daily life.
Wow, what a journey through these specialized health terms. We've truly taken a deep dive today, haven't we? Our aim wasn't just to rattle off definitions, but to truly understand the contextual usage and nuanced meaning of each word, equipping you for more sophisticated conversations and deeper comprehension in the world of health.
Absolutely. Mastering this lexicon doesn't just bolster your C1 level proficiency, it truly prepares you for advanced discussions across medical, wellness, and psychological domains. The depth of understanding you've gained today goes far beyond mere rote memorization. It's about genuine insight and the power that precise language brings.
As you go about your day, think about how the precision of these words, the very act of knowing the right term for the right context, doesn't just improve your communication, but might also shape our understanding of health policy, patient advocacy, or even personal well-being. How does language truly empower us in the realm of health? Something to ponder, maybe. If you found this deep dive valuable, we encourage you to like, share, and subscribe to this YouTube channel.